Gabi po sa inyong lahat. My name is Kate and I'm your host for this evening. Welcome po ulit sa ating Qcafe session, ang inyong favorite online tambayan tuwing Wednesdays ng 8 p.m. So I'm very excited for tonight's session because I will be interviewing a very, very interesting person. So this person, our speaker for today, earned his Bachelor in Biology degree at De La Salle University in Dasmariñas in 2001 and his Doctor of Medicine degree at the Pamantasan ng Lungsod ng Maynila in 2005. He is a diplomate of the Philippine Association of Primary Skin Health Physicians Incorporated and trained in national skincare in Singapore. He earned his distinguished Toastmaster norm in 2018. He served the constituents of the city of Dasmariñas health as a city health officer from 2011 to 2015. He is trained and certified by the Department of Health to evaluate drug-independent patients prior to rehabilitation. He specializes in drug dependence, dermatology, and hair restoration surgery. He is a passionate speaker and teacher. He taught legal medicine at the College of Law Lyceum Cavite from 2015 up to 2015 to 2019. He is a dynamic discipleship teacher at Church of God World Missions, Dasmariñas, since 2015 up to present. He is the founder and CEO of Encabo Skin and Hair Restoration Clinic in the city of Dasmariñas. He is happily married to Dr. Elizabeth Padilla and a loving father to Andrea and Kenzo. Let us all welcome Dr. Ryan Encambo, DTM, the finest of Cavite. All right.
Thank you very much,
Ryan.
Kate. Thank you, Kate. So excited to be here.
Ayan, kamusta ka naman po, Doc Ryan? How are you? How is your skin?
Doing good despite the many challenges, no? So
Yeah,
still, kailangan credible and you should not, in a way, give any hint that you're going through things, the challenges.
definitely.
Kailangan bright pa din.
Are you still able to operate right now? Is it in your local, okay na po ba yung restriction?
Yes. We are still considered frontliners, so we still treat skin diseases.
Yeah.
So for the meantime, yung mga treatments, medyo muna. Schedule na lang in the future.
Yeah, definitely. Anyway, I won't keep you. That was the introduction for you. Guys, I am so excited for this talk. I hope you sound off on the comments below. Let us know what are your thoughts. If you have questions, feel free to type in the chat boxes. Just comment on the Facebook Live and I will be monitoring it and we'll answer all those queries later after the talk. So take it away, Doc.
Thank you, Kate. So why do we need to mind our skin? Dok Ryan, it's pandemic, you know, and we have so many challenges. I have financial constraints. Why do I need to invest on our skin? It's because our skin is linked to our minds. Actually, in 2014, there was a survey done by the National Rosacea Society wherein 1,675 patients who are experiencing rosacea. Can we have a show of picture of a rosacea patient? It is a skin condition wherein there are reddish discoloration, there are bumps, and there are uh, very visible uh, blood vessels in the skin. Now, what happened is that 90% of the respondents reported that there was lowered self-esteem and lowered self-confidence. 54% reported to have anxiety and a feeling of helplessness. And 43% reported to have depression. And I get that a lot from my patients. This is only rosacea. What more if it's psoriasis, it's acne, if it's eczema? Our skin is related to our psychology, to our mind. Uh, That's why this branch of dermatology, derma psychology, is very new. Wherein truly what we are experiencing, our mind, in our psychology, it affects our skin. And it's a cycle. Whatever we experience in our skin exacerbates what we're going through psychologically in our emotions. Our skin is linked to our minds. That is why we need to, that's, so it's not vanity anymore. We really need to invest in how we look on our skin because it relates to how we feel and later on how we perform. We need to look better for us to feel better, for us to perform better. Okay. So in this topic, we would be discussing as well how to achieve glass skin. We would be explaining what is really the definition of glass skin. Also, what are the common mistakes in skincare? What are my top choices on in terms of 3 products, also 3 supplements, and 3 skin treatments, and the 3 things you need to look for in a dermatologist. Okay, what is glass skin? Glass skin is the ideal skin popularized by Koreans. It is almost like translucent, smooth, hydrated, dewy skin, like glass. There's a great emphasis on making it hydrated and very clear. Now, we are able really to achieve that if we are able to uh, prevent the committing of the most common mistakes. Mm. Uh, a smart person learns from his mistakes, but a wise person learns from other people's mistakes. And we cannot commit all of the mistakes. I have horror stories wherein people self-medicate and they started off trying products, and what happened is the process of restoring their skin to the original health was more expensive than the treatment that they used. So right now we're discussing the 10 most common mistakes done during skincare. Number one, it is the over cleansing with soap. Are you still using soap? Sometimes secretly I would have the shock of my life that up until now there are people who would still use soap. That's number one. It's a mortal sin for dermatologists. Use non-soap cleansers, lipid-free cleansers. Why? Because soap, especially ones that have really lots of lather, it means that it has a high content of detergent. So it can really strip off the natural protection of their skin, the oils, the moisture. What you can use is a hypoliquid cleanser. For example, Cetaphil or Physiogel. By the way, I'm not associated with these companies. What else? Micellar cleansers. if you are wearing makeup, oil based cleansers would be good. This is one from Human Nature. This would, bind with the makeup, and then you can use uh, a non-soap cleanser. The key word for cleansing is to be thorough but not harsh. Again, your skin is like a canvas. It needs to be thoroughly cleansed but not stripped of its natural protection. So number one is over cleansing with soap. Second is skipping toning. And a lot of dermatologists actually don't believe in toning. And there's a new product out there called essences. Now, toning, aside from the additional cleansing, is actually it restores the pH. pH means acidity or the basicity, or being the part of the acid scale. Um, the acidity or the pH of the skin is near the mild acidity, which is 5.5. If it's higher pH to bitter, tendencies, it is like prone to other problems, the skin irritations. The toner would put the pH into the normal level, and it prepares the skin to receive the other treatments that you'd be applying to your skin. Essences, especially this one, this is from Time Revolution. What it does is it's able to absorb better the creams, the essence, the treatments that you'd be applying. Wow, Doc, ang dami naman yan. May toner na, may essences pa. And later, I would tell you why it's all important. Remember, you need to look good, to feel good in order for you to perform better. Third is a lot of people, because they are oily, they skip the moisturizer. Hindi ko na kailangan yan kasi, di ba? Ang oil, di ba, yun doon naman yan to trap the, the hydration or the moisture. But the thing is, you can be oily and dry at the same time. You can be oily and dry at the same time. So especially if you are using anti-acne medications, tendency is a lot of the surface of the skin is becoming dry and sensitive. Moisturizers are very important, whether you're oily skin, sensitive skin, or acne-prone skin, because the medications will surely make your skin sensitive. The moisturizers will calm down the inflammation and the irritation. Okay, so unfortunately, the anti-acne meds have that effect. It's a bit harsh on your skin. Unfortunately, the effective substances that can help, work on your wrinkles are harsh. And also, whitening agents, did you know? Automatically, they can also dry your skin. Now, moisturizers would help on restoring the moisture. Actually, moisturizers trap the water. What happens is, if you're not able to moisturize, there would be micro cracks in your skin. So it's very easy for it to, or allergic substances and other microbes to enter those micro cracks in the skin. Fourth, it's exfoliating your skin too often. Some people use it as cleanser, exfoliators. Are you familiar with that? Scrubs. Sometimes we use scrubs as our cleansers. Well, we should limit it to like once a week or twice a week. If your skin is already dry, once a week is enough. And we love kasi yung sensation of whenever we scrub. It reveals the glow of our skin. It becomes smooth instantly. But overly scrubbing our skin can make it very sensitive. So for dry skin and already sensitive skin, just once. And for oily skin and acne prone, you can try like twice if you're able to tolerate it. Thrice would be the most frequent. Fifth would be the most common mistake is not taking care of your scalp. I'm guilty of this. Not taking care of your scalp, your neck, and also the back of your hands. Sometimes our hands reveal our age. A nice tip would be whatever you apply on your face, you apply it to your neck as well as the back of your hands. Whether you're cleansing, toning, or moisturizing, or other treatments, or also exfoliating, you apply it to your neck and to the back of your hands. Now, for your scalp, you need to invest now, whether you're male or female, to uh, those that would safeguard the your hair shafts or the hair follicles. The scalp, if you have healthy scalp, you have healthy hair. Okay, so don't neglect your scalp, especially when you're in my age. It's very costly to have hair transplants, so take care of your scalp as well. Number six, and I need to hydrate myself a bit. Number six, and that is neglecting overall wellness. How's your hydration? How's your sleep? How is your exercise? You know, did you know that according to the American Dermatological Society, that our skin gets renewed every 28 days. So that's 4 weeks, almost a month. Did you know that if you are able to sleep within the 11 p.m. to 2 a.m., that window period, your skin rejuvenates and has a faster rate of turnover to just 14 to 18 days. That's almost like two weeks. And this is the advice I give to adolescents whenever they have acne. If you want to have faster recovery for your acne, sleep within that window period. Whether you slept for 7 to 8 hours, but it's not within that window period, not much impact. You need to sleep within that time. Doc Ryan, paano naman kung nag-work as call center agents? We need to simulate that. We need to reverse it. We need our brains to feel that it's already nighttime during the daytime by making the room really a bit cool and really dark. So you have to put like cloths on the door so that there would be no light. This would fool the brain that because there's the part of our brain, the pineal gland, that detects the rhythm, the it's sort of our body clock. Whenever it detects that you are able to sleep within that window area, you secrete, the rejuvenating neurotransmitters, the antioxidants like melatonin, and you're able to not only rejuvenate your skin but all cells of your body. If the skin is changed within 28 days, the whole body is actually changed total 7 years. You have a new body every 7 years, and you are able to maximize that if you're sleeping well, also if you are exercising as well. Especially now, there's a study that shows that there's a lower risk for you to have a serious case of COVID if you are exercising. And you need to hydrate yourself. There's no moisture, no water to trap. So how can you tell that you're drinking enough water? And actually, in the clinic, whenever we have a device where it's able to note the percentage of your water, because a lot of problems in the skin arises due to dehydration. So you would notice a lot of lesions on the back because uh, it's a sign of dehydration, as well as your sweat and your oil are becoming too toxic. That's manifesting in your skin. So hydrate. How could you tell that you are drinking enough water? When you take note of the color of your urine. If it's already clear, then you're drinking enough. So I'll be drinking some liquids, better with electrolytes and antioxidants. Okay, so neglecting overall wellness. And you should also include um, your emotional wellness as well. You know. Be in the midst of people who are positive, who would say, who would encourage you, who would, say positive words to you. You know. Words are like honeycomb. They are healing for your soul. Okay. Number seven, another common mistake is that people think that more is always better. Well, it's not. No? Not because you have a lots of treatments, it means that it's better. Less is better. Also, in terms of concentration of the active ingredients, we think that it's better. For example, there are certain acids that should be kept the lower concentrations. For example, salicylic acid for acne. A lot would a lot of people would be using like the 4% to 7%. You know. The idea would be 2% for acne. If you would exceed more, it is ideal now for warts and for thick skin. What would happen is that we have lots of patients who would go to us because of damage in their skin. What else? Sometimes you think that more application is better. No, there are no studies that verify that if you apply more than prescribed by the doctor, it would be more effective. Actually, a thin layer of any ointment or cream is enough. And sometimes, and most of the time, once is enough, especially as well for cleansing the skin. Sometimes we tend to think that washing too often, twice a day, is enough. More is not necessarily better. Are you learning so far? Right? Can I have a thumbs up if you're learning so far from these tips? So that's number seven. Number eight, I think it's common sense, but I need to say this because I have lots of cases in the clinic. Touching the face too often. Mm. And not only for the skin, but because it's pandemic, our hands are really, you know, dirty. It's really, have contact with a lot of microbes, and you would be spreading the bacteria. You would be adding insult to injury. You would be worsening the inflammation. Mm. I would be able to, like a detective, I will be able to know whether the patient is touching his or her face because of the scars, whether the patient is right-handed or left-handed. If the patient is right-handed, I would see a lot of scars on the right side of the face, and I would gently remind that person, don't touch your face, because it would result to a lot of sometimes almost difficult to reverse scars. Okay. Number nine, not changing the pillowcases and masks regularly. So there's a high a high incidence of what we call mask knee. You know. And that's why it's very important to maintain the basics, because the mask um, causes friction in our skin. What more if we are not changing it regularly? And sometimes the reason why some of my patients, their acne are not, resolving or not getting well is because the pillowcases, it's not changed regularly. Also, disinfect your phone because it comes in contact with your skin. So there you have it. Those are the 10 most common mistakes done whenever doing skincare. So how do we make our skin like glass skin? Just reverse it. No? Just reverse it. Okay. So don't do those mistakes. Okay. And lastly, it's only number nine. Lastly, I forgot. It's adapting. No, adapting. No, no. It's adopting. Actually, adopting other people's routine. Adopting other people's routine. It's just because it is effective to other people, definitely it will not be the same with you. I have a device in the clinic called Visia Analyzer. It's a computerized, a high definition camera, the most expensive camera I bought in my whole life. what it does is it's able to take note of the condition of the skin from the the spots, the texture, the number of pores. Literally, it's able to detect it. And also, it notes the number of bacteria, uh, the redness, the irritations. And I can see that a lot of people, they have different responses. They have different responses to, uh, to every treatment. And we need such tool in order for us dermatologists, to compare whether they are responding well. So it is very important. Follow up is very important. After 2 weeks, if they have good sleep and if they are religious, obedient with their regimen, prescribed treatment, uh, there would be results after 2 weeks. And I would like to show you my visa result. Yeah. So next month I'll be turning 40, and there you have it. I have 30 true skin age, 30. So with this machine, it can also give a non-biased assessment of the age of your skin. So it has 8 criteria: the wrinkles, the texture, the pores, and then the UV, the brown spots, the melanin deposits, the redness, and lastly, bacteria. If you would notice, I have a low grade for bacteria because it's already in the afternoon. I am due for another cleansing. So there you have it. So I never overpromise with my patients. I always tell them we can achieve 10 years younger, 10 years improvement in your skin. That's a reasonable goal. But there are patients who are able to reach the 15 years younger skin, the 15 years younger. And so every skin is different, and there should be a tailor fit approach in every treatment, and we should be by this tool, by the Visia. So are you learning so far? Learning so far? So there you have it. Those are the 10 common mistakes. What about the products? Dr. Ryan, how can I achieve the skin of those K-pop idols, the K-pop stars who have, almost like zero pores and very hydrated skin? you know? I could recommend to you like 3 products. Number one, we have really changed the list a lot of times because we don't want to like over like overload you with too much information. So we narrowed down to 3, and we have altered the list a lot of times. Number one is vitamin C serum. I have one here, and I use it, vitamin C serum, and it is able to, you know increase the protection effect of your sunblock by 10 times. It's best to apply before your sunblock, before moisturizing, because it's able to fight off the free radicals caused by exposure to the sun. So the best concentration would be like 10 to 20%. Again, more is better. If you go beyond 20%, it may irritate. It's still an acid. So you can stick to 10% and then try to, if you're able to tolerate well. So you can probably start once a week and always do a patch test, probably here or here in your arm. Leave it for 24 hours. If you're able to tolerate it, then it's time to put in on your face once a week or like twice a week, starting in the morning. Starting in the morning. And you should note that bottle of the vitamin C serum should be it should have a dark tint because it's very sensitive to UV light. It's easily oxidized. So you don't want to waste the antioxidant properties by having it exposed to UV light. Also, it has a brightening effect to prevent also for those dark spots. So there you have it, vitamin C serum. Second is niacinamide. So this essence, niacinamide as an active ingredient. If vitamin C is, of course, ascorbic acid, Niacinamide is vitamin B3. uh, And it's very good for whitening. It's very good for decreasing the number of your pores, actually. It also stimulates collagen. And what else? It's a good lightening agent for your melasma, for the patches of your skin. It can be in your essence form, it can be in a cleanser, it can be in a serum. Third, retinol. So a while ago, it's vitamin C, then vitamin B3. Retinol is a vitamin A derivative. Now, it's very good for wrinkles. If you have dark circles, if you have crow's feet, best to get a product with retinol. The perfect or the best concentration would be like 0.04 to 0.1%. I'm very particular with percentages because, again, more is not necessarily better. uh, And you can start once a week at night. Now, these are all good products. So you may be thinking, I need to have all of them. Well, you need to control yourself. First, try with one product. And then try once a week, twice a week, because these are very potent active ingredients. They're not like the basic or the routine stuff, the cleansing, the moisturizers, and these are really serums and treatments that can really have a very good effect. But too much of it, you might get irritated. So um, try one product at a time. Start once a week, twice a week, then and then if you are to use another active ingredient, see to it that they would not go together. Put one in the mornings, best would be the vitamin C, and then in the evening would be, for example, niacinamide. If you are able to tolerate well, then you can add the retinol. But see to it that in the evening, the niacinamide and the retinol should not come together, or else, and I have experienced this, a very warm and very like a burning sensation, because they are really potent active ingredients. More is not necessarily better. Okay, so give me a feedback on the effects of these products. Let's go to treatments. If you have the budget, then it's good to invest also in a once a month or twice a month treatment. So there are a lot of treatments out there. And what are my favorites? Again, we have really deliberated on these treatments, and we came up with three. Number one is hydrofacial. Are you familiar with the diamond peel? The vacuum with diamond crystals? I'm sure you're familiar with this. But there's a new one called hydrofacial. It also has a vacuum, but the difference is it has this water vortex that it's like a cyclone within that vacuum. Can we show the illustration? So this is the hydrofacial, this is the tip, and it's able to suck all the gunk, the dead skin with the, like a vortex, water liquid. So water is hydrating the skin while it's also sucking the gunk, especially from the pores. Yeah. And while it's doing that, it is also delivering active ingredients like hyaluronic acid, a moisturizer, a hydrator. It's also deliver alpha hydroxy acid simultaneously. So there are changes of tips in order to, this one is delivering actually the essences. The first one was removing the dead skin. The second one was a high vacuum to remove the blackheads. The third would be applying the moisturizers, the hydrators, the active ingredients. So there you go, the hydrofacial. Second would be energy treatments. We lose collagen, the fiber that makes up the skin, the fiber that makes our skin plump. I'm sure you heard of it, collagen. 1% per year after age 18. So I'm turning 40 next month. So 40 minus 18, That's 22%. I've lost 22% of collagen. So what happens is my pores become more visible. There's sagging of the skin. There's this what you call the triangle of youth. This shape of the face. But as we get mature, because of the loss of collagen, it becomes square. So there is loss of volume here and migrating here in this part. So you would notice that there would be like tissue here. And eventually it would be so,
Yung sinend din
uh,
sa akin ni Update
the
Mall.
volume would
Kaya
be
kinalog sa'yo.
really less and most of the volume would be here. So it's like a reverse. It's like a pyramid. So you would notice that uh, more mature people have a pyramid shape of the face versus the young looking. No? So sabi daw nila yung hugis bigas. No? But we call that the triangle of youth. Okay. So why did I discuss that? The reason that there is loss in volume and there is, uh, you know, the sagging of the skin in order to defy gravity, you need to stimulate collagen synthesis. How do we do that? Um, through energy treatments. What are energy treatments? These are the RF, radio frequency. These are the Ulthera, the HIFU, the high intensity focused ultrasound, and also what else? Fractional lasers, the ablative lasers. So these use uh, energy in order to make micro injuries. Imagine that micro injuries within your skin, in different layers of the skin, depending on which treatment. RF on the superficial layer, the HIFU, the ulthera, much deeper, the thermage, a bit deeper. So this is a HIFU, so it is able to deliver ultrasound to the deep parts of the skin in order to make micro injuries, and then the body would repair. Then the cells would create new collagen fibers. Thereby, you would notice that there would be firming of the skin right after and few days and months after. So very promising. That's why a lot of the treatments only require like once a year, excuse me, once a year, like every 3 months, every 6 months, because you don't need to do it very often. Uh, the shortest probably would be, again, once a month, especially for monopolar RFs. You can't do it like every week or every day. Why? Yeah, it may stimulate collagen, but remember, the skin changes every 30 days. And the new collagen fibers are being stimulated and built, synthesized every 28 days. If you are injuring the skin again without reaching the 28 days, it would defeat the purpose. It would damage the newly forming collagen. Again, more is not necessarily better. So there is really a gap between or interval between treatments. Okay. What happens to patients who like have the treatments too often? They look so thin and gaunt that they have this pyramid shape of their face and they look very mature. They have firm skin, but they look very mature. So what we want is, very plump, a lot of volume, full of collagen fibers. So those are the energy treatments. To complete the list is the BTS facial. BTS facial. Now, BTS stands for Botox and Thrombocyte Serum Facial. Now, so it means that we get blood from you, also known as vampire facial, but I like to call it BTS facial. Drug will be extracted from the patient around like 10, 10 mil, and then we would centrifuge it, and then we will get the platelet-rich or the thrombocyte-rich serum. And then we would be doing microneedling. So this is the image of microneedling, wherein after applying anesthesia to the patient, anesthesia to the patient, Um, Microneedles would be inserted. Oh no, microneedles would be applied on top of the skin to make micro holes. And then we would be applying the serum. Also, Botox. Are you familiar with Botox? The one that would remove erase the wrinkles. It can also be applied while the pores are still open in order to uh, calm down the oil glands of the skin. Also, it would make the pores very refined. So that's the BTS facial. Botox. So if you are afraid of the Botox treatment that makes you look frozen, the BTS facial would make you look fresh, because it's only delivered on the top layer of the skin. So what happens is the patient would say that they have refined skin, they have less visible pores, and they have less oiliness, and they notice that their acne are getting well faster. So the hydrofacial, the energy lasers, and the BTS facial. So have you learned a lot so far? Can you still handle more? Can you still handle more? So what are the three things you need to look for a dermatologist? What are the things? First is, of course, the medical degree, medical degree diploma. You know, uh, there are a lot of skin centers out there who, um, you know, when we say dermatologists, these are uh, graduates of, the MD degree, and also are board certified and are members of societies that are PMA, Philippine Medical Association, certified associations. This would ensure that, because doctors, when we took the oath, our oath was to do no harm. Sometimes it makes me the term doctorpreneurs, sometimes it gives me a cringe, because first of all, I didn't took up medicine to be a businessman. At the end of the day, I'm still a healer. So I'm not after earning money. earning money uh, Money would follow if you are doing or giving value or solving the solutions of other people. But you see, the foundation for every heart of most doctors out there, it's really to uh, help the patient, heal the patient, um, health. And doctors, skin specialists, dermatologists who really graduated from medicine, we are able to treat the patient in a holistic way, not just the skin, but the other organs as well. So before we try treatments, we see to it that it's really study based. There are evidence based studies behind it. So first is, whenever you go to a clinic, look for the MD diploma. Second, look for a Visia skin analysis. I may be biased, but yeah, it's very difficult. I have already a bit of a lot of patients, and it's very difficult to remember the original state of the patient. It's like guesswork. You'll be guessing whether they are truly. You would be relying on the subjective comment or experience of the patient. But with this high definition camera, you would be able to see, and the patient would be able to see for themselves that there's really an improvement. There's really an improvement. Now, if there is no Visia, actually Visia is very expensive. What they can have is a less sophisticated skin analysis, or simply a camera, a high definition smartphone. They should document the before and after of the patients. Okay, so if they don't have the visual skin analysis, at least they take the pictures of the patients. And what another thing to complete the list is, the dermatologist should be a Toastmaster. No? Kidding aside, no. Now, I mean is that the dermatologist should be uh, both a counselor and a coach. You should be uh, a communicator and someone who listens and able to encourage the patient. So, best if the dermatologist would, join a club, a Toastmasters club. So there you have it. You should have an MD diploma. You should document the before and after, and you should listen and communicate well and encourage the patient to have overall wellness. So there you have it. So rather than giving the 10 common mistakes, I'm giving you the 10 commandments in taking care of your skin. Number one is, cleanse your face only twice a day with a non-soap cleanser. Second, don't skip the toner. Use toner and essence. Sometimes you don't need to apply with a cotton. Just apply it. Moisturize within 3 minutes after the cleansing and the toning. While it's still damp, while it's still moist, apply the moisturizer. Exfoliate once or twice weekly, not every day. Also care for your scalp, neck, and the back of your hands. It will do wonders. Sixth commandment would be invest in nutrition, fitness, and sleep. Especially during the pandemic, it would boost your immune system. A lot of patients noted that those who became positive because they lack sleep. So, a bit control for the Netflix, for the videos, for the what else, for the K dramas. If you want to achieve K-pop skin, glass skin, a bit of a restraint on the K dramas. They are a bit addicting. I'm guilty of it. Stick to the right concentration and dosage. Avoid touching the skin and face. Regularly change your pillowcases and face mask. And seek an expert, seek a dermatologist, and have your own tailor-fit skin regimen. Okay. So to wrap up, I started with why do we need to mind our skin? Why do we need to mind our skin? Because the skin and mind, they are linked to each other. When we look good, we feel good, and we are able to perform better. And to end, I would like to give you this quote that says, self-care is giving the world the best of you instead of what's left of you. So I give back the control to Kate.
Hi! Oh my gosh. Doc, grabe. Just listening to you, oh my gosh. Ang dami ko nang naiisip na mga pagkakamali ko. Doc, I have skin. I was just really, I was checking all my I actually have my routine kit here. Kasi
Mm.
while you were talking, I was checking out all of my products. And I was checking, oh my gosh, my niacin. Ano yun? Ano nga ulit yun?
Yeah,
Niacinamide. I
niacinamide.
have it. Oh my
Oh, very
gosh.
good.
I was checking, may vitamin C din ako. Kaso, why is the packaging wrong? O, di ba? May mga questions na ako for my
Mm.
dermatologist. Anyway, but I was really, your talk was so enlightening. As I was browsing through nga, I took screenshots of the 10 commandments. And I will definitely review it later on kasi I think this is something that most of us we do not know. The reason why we commit all these mistakes is because hindi tayo aware. We're so used to the old-fashioned routines that has been handed down to us by our parents, our grandparents, and whatnot. Lalo na yung mga tradisyon-tradisyon. That's why, alam mo yun, sabi ko nga Lola, bakit gano'n? Naligo naman ako ng 3 tabo ng tubig nung bata pa, nung nagkaroon ako. Bakit ang dami kong pimples? Mga gano'n. Diba, we all have those different types of traditions na definitely you do not have to live with those anymore. And yeah, you should listen to your doctor. So it's really enlightening to have talks like this wherein we can get to actually discuss with the professional. So if you guys have any questions, you can go ahead and type it in the chat box. You can comment on Facebook. I would like to say hi to our Facebook viewers. Hi kay Arnie, she's watching. He's
Wow.
you're her favorite dermatologist. So and hydrofacial is check. Ayan. So
Hi,
yeah,
Arnie.
I have a few
Actually,
questions.
she was the model in one of the videos. You noticed it's Arnie, the one who's been examined by the Vizia, my
Oh,
very beautiful Encabo angel Arnie.
okay.
Hi,
Sure.
Arnie.
Hi. Okay, so we have a few questions here, Doc, that we want you to answer, Sana. First
Go
thing,
ahead.
since the pandemic happened, work from home has been a trend. Is it necessary to use skin moisturizer and sunblock even though you're just at home? Can you skip that
Yes,
process?
you can't, no? Especially uh, as I explained earlier, the moisturizer is very important in order to keep your skin elastic and hydrated. If you skip it, especially if you are in a bit mature stage of your life, your skin is becoming a bit thin
Mm,
and not so flexible. You have to hydrate it in order it would withstand, the damages, the external injuries, and it would prevent like eczemas and other skin problems. Now, SPF, oh, we don't need it kasi nasa loob naman ng bahay. But, did you know that if you are taking selfies and using devices, it has radiation and blue light that can cause skin damage and premature aging. And actually, I noticed that in students, though they are inside the house, they're quarantined, but because they have transitioned to the online learning, I noticed that in the Vizia skin analysis, they have poor ratings or assessment in terms of the UV spots.
mm,
Truly, there is still skin damage, premature aging when we are exposed to lights, the visible lights.
yeah.
So before you take your selfie, before you browse your Facebook, apply your sunblock.
Yes. Okay. So a follow-up question to that, Doc. What is the recommended number of sunblock to be used? Ayan. Because right now, ako
SPF.
personally, I'm using, this is a 50 plus.
Yeah, that's a good number. I have also mine. It's 50 plus. So it would really, 50 is enough. If you want to go higher, that's good. But you need to take consideration of your comfort, because the higher the SPF, you would notice that the it's a bit, heavy. It's not
Mm-mm,
anymore lightweight. You
mm-mm,
can really feel it's a bit greasy because it's a physical sunblock. So the ingredients, the titanium dioxide, although these are antioxidants, the zinc oxide, it's much heavier.
yeah.
So these are either physical or chemical sunscreens. So 50, if you're able to tolerate higher, like the 100 plus, well, it's good. But
Mm-mm.
whether it's 50 plus or 100 plus, you need to reapply it
Oh, okay.
in the morning and a bit on the during lunch,
Oh my God.
because
That I
yeah,
did not know.
another nugget of wisdom, that you have to reapply it.
Mm-mm. Yun.
Especially if you are going outside and drive and take a
Mm-mm.
walk.
I've actually noticed because there's a lot of products in the market, 'di ba? Ito na talaga yung parang pinaka nahihirapan yung mga tao to choose what type of products would really
Mm.
fit their skin. A lot of talks have been going on communities asking one another, ano ba yung skincare routine mo? Kasi earlier you mentioned, 'di ba, na it's best also to like, check out what works for others, ganyan, parang get referrals or whatnot. Pero at the end of the day, go check it with the doctor, di ba?
Yeah. Very overwhelming, no? And very confusing. And sometimes it's a bit frustrating kasi ganda ng effect to your friend, and your friend was so sincere in sharing her secrets. And then lo and behold, na-damage yung skin mo. And I have that patient this morning, and she started with a rejuvenating cream, and uh,
Guilty.
the expense of, she had acne severe, a severe case of acne, and really it became an
Nasunog ba
expensive
yung skin niya?
experiment. It became
As
a very expensive experiment.
yes. Actually, kasi
So
yeah,
yeah, go ahead.
rejuvenating sets, some of them talaga can be too harsh for our skin, no?
uh, I never I never have a like a set in my clinic. I always dispense based on the results of the visia, and whenever a patient has already a regimen, I try to stick with it. I just rearrange, direct whether how to, you cannot like uh, put products on the same time. So there's an art to it, and then there's a monitoring of whether there's a good response. There should be a monitoring. Uh, some of you may be asking, Doc, syempre exposed na sa dirt during the daytime, and then you're telling us to apply sunblock in the noon. This is a perfect use for wet wipes. Wipe your face a bit and then apply just a minimal amount of sunblock.
I
Okay.
see. Okay. You've mentioned that there's an art to how you put your products. So the question, a follow-up question to that will be, is there an ideal like time frame? Like, is it gonna be 1 minute or 2 minutes or until it totally dries before you put on another product? Like, let's say for example, right now, for me, kunyari, I am being treated for my acne. So I have like, 4 products I put. Tapos salit-salit pa siya. Pero what I do right now kasi is I wait until it dries and then saka ko apply ng the next one. But earlier you mentioned na there need to be a time frame to apply
Yeah,
moisturizer na medyo plump or
yeah.
wetish yung skin. So is there really like how do we determine how to apply the product next?
Actually, you don't really need to wait for the product to dry. Actually, I whenever I do my routines, it's very quick. It's very
Mm-hmm.
quick. As much as possible, you minimize the mechanical stress in your skin. So whenever I cleanse, and I cleanse and then wash, and then I get piece of cotton, or sometimes I use my hands. If my hands are, it should be really clean, to get a toner, or just put an amount and then I apply it really fast, and then I get my moisturizer, one, two, three, four, and then I spread,
Okay.
and then I tap, and
Mm-hmm.
then I get, for example, one, two treatments, usually for acne, one to two creams, right? Apply here, spread, and then you don't have to wait until it dries up.
Okay.
If you are go to bed, you should have yourself, make sure that it's dried up before you go to
Mm-hmm.
the sheets. So, but there's no really, no, there's no like evidence. Uh, you don't need to
That
put
proves the
too much, too thick, and
yeah.
it would not rob you of your time to sleep. That sleep is more important.
Actually,
For the creams,
like we have
for the
what
creams
we
to be.
call 10-step Korean routines. Hindi
Oh
ko
my,
talaga siya kaya. Oh my God.
no, no.
Those are the things kasi talaga that people are being addicted to right now. Kasi akala nila like all those Korean stuff and all. I mean, Doc, is this a myth or of some sort for us? Like especially for us Filipinos. Kasi 'di ba our temperature like it's different here in Pinas. So hindi talaga pwedeng like apply mo ng as if kung ano yung ginagawa
Yeah.
nila. Cause
Yes, yes.
different tayo. So
Yeah.
what is your thought? What is your take on this type of like routine, yung mga 10-step Korean stuff and all? Is it
Well,
really applicable for skin?
it's not sustainable, and for the current situation, it will not be economical as well. So balancing the effectivity and the economics, we should strike a balance, as well as, yeah, y- y- the routine should be something you enjoy, but it should not be a sort of an obligation. Uh,
Trabaho.
Trabaho. Ang dami nating iniisip, ang dami na nating kailangan gawin, 'di ba? Especially, it's not practical for a
Yeah.
parent who have children. isn't it?
Mm-mm.
So yeah, that's why I keep on emphasizing less is better. Less
Yeah.
is better. And it may sound cliche, but what is essential?
Oh my gosh. Essential
What
ba
is essential?
yan?
What is essential? So let's stick with what you really need.
Mm-mm.
Uh, let's focus with that, and then you'd be amazed. You'd be amazed. I've seen in visa results people who have very good. They never look their age. They're 10 years to 15 years younger because they have healthy skin. Oo.
Okay.
And really, my goal is for for the person to have just like the basics: good cleanser,
Mm-mm.
toner, a moisturizer, a sunblock.
All right.
If
So we've talked about all that topical stuff.
mm,
Talk about naman what we put inside our body. Do you have like a suggested anything that you need to intake naman? Like let's say
okay.
vitamins ba for a healthy glowing skin? What are the things na feeling mo mandatory talaga that you should like take? Like this is as a doctor like hey, take this if you want glowing skin. Take this for like you have issues with acne, don't eat nuts. Yung mga ganong stuff. What are your take
Mm.
on that, man?
Actually, for the acne, just to the only proven food that is contraindicated for acne is dairy. So cheese, milk, that's the only proven one. For the nuts, no. Actually, it's good for your skin. I would give you a visual on my top three supplements. I get this a lot now, and it's also good for the current situation. One is a multivitamin.
Yeah.
One is a multivitamin, and like this one, a multivitamin like this. But so I'm not again affiliated with this.
Yes,
I'm not
yes.
an
We're not
endorser, but
being
the multivitamin.
sponsored not or of these
Uh,
brands.
yeah, because the best brand is Encabo. Kidding aside, but of course, ideally, you need to get your vitamins and minerals and antioxidants from the food you eat. So always, I remind my patients, eat the colors of the rainbow. Yeah, eat the colors of the rainbow. Second would be probiotics. Probiotics. Yeah. Um, Unfortunately, I have to prescribe antibiotics to my patients. So what happens is the good bacteria gets wiped out, and there are for those patients with skin asthma, it's because they have less probiotics. When you add probiotics in your diet, it really improves the hydration, the wrinkles, the pores, because really good bacteria is really they sustain us, they impart very good substances not only for your skin but your whole body. Did you know that we are only 10% human cells? We are 90% bacteria, good bacteria.
Oh my
We
God.
owe a lot to them.
Pala tayo.
So whenever so a lot of the DNA, the substance for
Mhm.
DNA come from bacteria. A lot of the substances manufactured by good bacteria in our intestines. So and a lot of our diets right now, they are laced with antibiotics. That's why we are, um, you know, the good bacteria are decreasing. So get a good probiotics.
When you say
Whenever you,
probiotic, Yakult? Yakult na to?
yeah, like
Mga ganun.
the
I mean,
like
that's the only
the
probiotic I
yogurts,
know.
yeah, yogurts, but also the fermented vegetables like kimchi, very good kimchi.
Really?
Can we have an uh, the visual for the fermented food? Yeah, no wonder the
Oh,
Koreans. Yeah.
nice.
Uh, even their
Side dishes eh.
their internal organs, the Koreans, they look good because of the probiotics. A French surgeon said that. Yeah, not only their skin, but
Mm-mm.
even their insides are very good. No, a French surgeon said that, and I was amazed. So always include uh, uh, probiotics and fiber. Prebiotics is it's the fiber. Okay. And lastly, to
Yeah.
complete the list, it's good oils, essential oils, good oils like olive oil, virgin coconut oil. I'm not surprised that virgin coconut oil is considered to be a treatment for for COVID because of the antioxidants, antimicrobial properties. It not only the skin but the whole body. they really impart very good properties to this to our health. They really boost the immune system.
Is cocoa
So
MCT part of this good oils?
which one?
Cocoa MCT po.
Cocoa. Is it virgin coconut oil?
One here, oh my gosh. Because I take
Mm,
this for keto.
yeah, yeah. So it's a very good source of clean energy without the excess
It
weight.
has
And then it
electrolytes.
actually it is able to burn the excess weight more efficient. These oils.
Oh my gosh. All
So
right.
take lots of nuts as well and fish in your diet.
Okay, eto feeling
Wow.
ko, this is like a tanong ng bayan. What is the best remedy to remove dark eye circles? Like
Okay.
this.
So of course, no, I mentioned it. Sleep is the number one. Sleep is number one. The retinols,
Mhm.
niacinamide, these are good products. Products with vitamin K, it improves circulation. Tea bags, caffeinated tea bags,
Mhm.
good for circulation. And cucumber, the very the very familiar cucumber. But for the active ingredients to be released, you need to grate it.
Oh,
Don't just slice it and put slices. For you to maximize the active ingredients, grate it,
and
make a
then
mash.
why?
Not only into your eyes, on your eyes, but on your face. It's like a
Ah,
mask. It soothes your
cucumber.
skin.
Do
If you
you
have
have
a
anything to add to it? Or just the cucumber lang and the juices of the cucumber?
it can stand alone,
Mm-hmm.
and best to you can also add my other two favorite
Mm-hmm.
home regimens that you can use for your face.
Mm-mm.
But again, with a grain of salt, have a patch test prior. Observe within 24 hours. But because a lot of people may be allergic to cucumbers,
Yeah.
there are cases. So try first to apply the grated cucumber here on your arm, then
Mm-hmm.
wait for 24 hours for any reaction.
Mm-hmm.
Another is aloe vera.
Oh, okay.
This was part of my thesis in BS biology, aloe barbadensis. So it's very good for burns. So it's very good for acne as well, to also for anti-aging. Yeah, you can mix it with cucumber, and you can mix it with lemon juice. So
Oh my.
take note of this recipe. For every 1 teaspoon of uh, aloe vera, pure aloe vera, one fourth, only one fourth lemon juice. Okay. So another one, and also my favorite, is honey.
Oh.
Honey. Uh,
The pure ones ha, not the fake ones. Because there are a lot
yeah.
of fake ones circulating in the market.
So a good one is manuka honey.
Mm.
Manuka honey. The, it's from, I think, New Zealand, if I'm not mistaken.
I only
So of
see those
course,
sa Tenor.
so it's antimicrobial, it's anti-inflammatory, it has antioxidants.
Mm-hmm.
So if it's you know honey is a bit sticky, so you can dilute it with water. So for every 1 teaspoon of honey, you can add 1 teaspoon of aloe vera,
So
and you
you
can also
just
add
apply it like a mask.
like a mask.
And does it
Again,
po if you like, kunwari you use this, are you familiar with the collapsible na mga mask? Yung nabibili ng mga Korean?
yeah, yeah.
Is
So
that
you
good?
can make it, yeah. Actually, I've seen
Because it's easier to remove.
masks. Yeah, I've seen masks with a lot of organic material. It's very good. Yeah. Shout out to Mira, the conscientious mask.
Yeah.
She made me. Yeah, she like had me try it. Very good. I can see the results in the Vizia. So
Mhm.
yeah, again, take it with a grain of salt. Always observe if there's any reaction, because one of my staff members, she is allergic to aloe vera. It's a
Apparently,
very
yeah, it can
So
get
a
allergy.
lot of people may be allergic to honey.
Mm.
No? Honey. So be careful with that as well. Okay?
Okay, siguro for my last question, isang bagay din na ano, we all know that there is what we call pink label. This is something the products are being marketed exclusively for women. So the question here is, can men also use women products? Especially when it comes to skincare like this. Or do we really have to stick to our gender products? Or is there
Actually,
such a thing even?
actually nakikigamit ako sometimes ng products ni Mrs. eh. So, sabi niya, ay, ang ganda nito, ang ganda nito. So ako naman, try naman ako, try. And then I would observe din sa Vizia. So there's no problem with men using pink label products for women. No problem.
Mhm.
Yet, there are certain needs of men na different from women. For example, we are more oily because of testosterone. Uh,
Plus
we
female
have
hair.
yeah, we have thicker skin. Plus, whenever we shave, we already have a sensitive area here.
Oh,
So,
okay.
so there's a regular exfoliation. So we need products that would cater to that because
Mm.
we are already sensitive. So we have a combination of skin, an oily T-zone, pores, and then we have a sensitive area. So products that would cater to that. Uh, that's why they are packaged for men, but there's no problem with using yeah, products for women.
Yeah, nakaka-conscious when you mention T-zone, yung light from the nakakita ko agad yung T-zone ko. Anyways, so Doc, to end this up, I would like to ask last talaga. Do you do online consultations? And if ever, how can we contact you po? Do we need to
Yes.
set an appointment? Is it really effective, the online consultations? Kasi let's say, my camera is not that good. Can you see through my acne? Yung mga ganong stuff. How will that work out for you po?
It's a good alternative, but nothing replaces, face-to-face
Yeah.
consultations. And especially in the clinic, we have the Vizia skin analysis. No?
Mhm.
But for those who want to reach me, yes, we do online consultations via Zoom. You can set your appointment via our FB page, Encabo Skin and Hair Clinic. Yeah. So
All right. So that's
actually,
Encabo
yeah,
and Cabo
Encabo Skin
Hair.
and Hair Clinic.
All right.
Yeah.
Any
Or you
last
can,
words for tonight, Doc, before we end this very informative and helpful session?
well, since the skin and mind, they are really linked to each other, we need also to invest in our mind. So um, be mindful of what you partake, uh, uh, because if you are to, you know, have social media, be mindful of the content. And I congratulate Muzen for, yeah, putting out there very good content, good words. Um, Stick to people who have positive words for you. Uh,
Mm.
I mentioned honey. Gracious words are like honeycomb. Right? They are healing for the soul. Healing for the soul. So have surround yourself people with have are very gracious, and be gracious to yourself as well. Be gracious to yourself. Uh, and it's very difficult na pagandahin ng isang tao hindi maganda ang tingin sa kanyang sarili. So always, speak gracious words to yourself. Don't beat yourself too much. And if you have, it's within the word. If you have a merry heart, you have, a very good countenance. So congratulations, Muzen, and thank you for having me tonight. And I hope you learned a lot.
Thank you so much, Doc Ryan. Grabe, sobrang information overload. At definitely, I will be rewatching this live because I need to take down notes. I need to review the stuff that you have shared with us. And yeah, like everything else, sobrang daming mga nuggets talaga in this session. My main takeaway would probably be change your pillowcases. Kasi I'm right-handed, all my acne is here, I sleep here. So baka yun na nga. Anyway, so maraming salamat po for those of us who joined here on our Zoom call. And then for those of us who are still on our Facebook Live, I'm seeing your comments. Thank you so much po for joining us. And I hope you have shared this video to be able to help other people as well to learn about what Doc Ryan has shared with us. Because these types of informations are the things that we need to hear, to learn, and to understand. Guys, do not self-medicate. Especially when it comes to your skincare routine kasi that's your skin. You only have one. You live with it forever. So you really have to know how to take care of it better. So go ahead and check out Doc Ryan's clinic. You can do online consultations with him. I highly encourage that you talk to a professional before you apply anything to your skin. And yeah, so that's it for tonight. Thank you so much for joining us. We'll see you again on our next Qcafe session here at your favorite online tambayan, Moose and Core. See you next Wednesday. Bye, everyone!